You'd think the second you figured out how to manage an illness or cure it or prevent it, that everybody would find out right away. And all the hospitals and all the doctors and all the nurses and all the parents and all the schools and all the teachers would tell everybody so they'd know about it. But that's really not the way things happen. At the very beginning, in 1987, a lot of people were getting sick. The first cases in the United States were in '78. By '87, there were a lot of people, which means a lot of people who are healthcare workers were going to having to deal with people with HIV. And they were frightened. They didn't want to be in the same room as people with HIV. They were afraid that if they got spit on by people with HIV, that they would get HIV. Hospitals first, and then later the entire government, and then all of Europe, that is the United States and all of Europe, started doing something ordinary practice. If someone got stuck with a needle, and there were hundreds and hundreds of people every month that got stuck with a needle, thousands every year, what they would do is give them an antiviral. 24 years ago, we knew that if you took an antiviral after you were exposed, that it could protect you from getting infected with the virus. That's fantastic information. Of course, no one knew about it, except it became standard operating procedure in every hospital, in every clinic in the United States and Europe. Everybody knew about it and used it for doctors and nurses, but they never used it in the public. Groups in the United States, including AIDS Action Committee, including the American Center for Disease Control, told everybody, this stuff ain't, all that good. It only works 43% of the time. Well, it turns out if you look at the actual numbers, it works 43% of the times if you look at everybody, including the people who don't take the pill or who take the pill only sometimes. Well, guess what? In this particular case around the world, in this particular experiment, in this clinical trial, we took blood out of people and checked to see if there was any chemical in the blood, if the medicine was there. If you look just at the people who really had medicine, it was about 95% protective. So you'd think the headline would be, if you take this pill, you're 95% sure to not get HIV, which is a better record, incidentally, than condoms. See, if you got less virus around because you had less transmission, you're reducing the chances that anyone could get the virus. So the public health objective is to reduce the chances that someone will get HIV by reducing the number of people who have it. It's not about curing an individual. The problem with the CDC regulations is they are about how you should treat an individual for a disease and being absolutely sure that they're safe. If you do that, we'll never have a PEP or PrEP program in the United States. Let me tell you what the CDC recommendations are. That before you can get PrEP, you got to get a prescription from a doctor. You got to make an appointment with the doctor. You have to have blood taken. You have to be tested for whether or not you have HIV. You have to go back every few months to see whether or not you have a side effect from this drug, which happens fewer times than in aspirin. Massachusetts has a state bill that would create a commission. This commission would have people with AIDS on it. It would have doctors who've done research on HIV on it. It would have folks who got impacted by HIV. It would have AIDS service organization personnel who do outreach into the community. And this group of people would put together public policy and laws to make this program of PEP, PrEP, microbicide, clean needles, and so forth, available across the state of Massachusetts with the objective of having zero transmission. We know how to end the AIDS epidemic and put it behind us, just the way we did the smallpox. Unfortunately, it won't be the U.S. government that pulls that off, and it won't be your local church that pulls that off. It's going to be you. By opening your mouth and demanding to have pre-exposure and post-exposure prophylaxis, get these pills, demanding these pills and demanding the tests. Everybody should have access to the pills and the tests.